U.S. Surgeon General Jerome Adams and FDA Commissioner Scott Gottlieb rolled up their sleeves to get flu shots in Washington Thursday, doing their part to make sure the upcoming flu season isn't as bad as the last one. The CDC estimates 80,000 people died of flu and its complications last season. That's the highest death toll in at least 4 decades. There were also 900,000 hospitalizations.
It was especially deadly for older adults, pregnant women, people with chronic medical conditions, and children.
The CDC also reported a record-breaking number of pediatric deaths from the flu, 180 children.
180 families put a child in a grave last year because of a vaccine-preventable infection.
The CDC blames the severity on a particularly bad strain and lower vaccination rates in key groups.
More than 40% of kids were not vaccinated against the flu. Seeing a decline in coverage in this age group is very, very worrisome.
As for this year's flu season, the CDC says it's impossible to predict. It depends on how many people get vaccinated, whether a strain that's in this year's vaccine mutates or changes so that the vaccine doesn't provide good immunity, and sometimes a virus strain not in the shot unexpectedly shows up. Bottom line, the flu vaccine is still your best protection against becoming a casualty of this year's flu season. Scientists won't know how well the vaccine covers this year's viruses until they can analyze which flu strains are actually making people sick this year. And that doesn't happen until well into the flu season, usually not until January or even February. So the CDC is recommending everyone get their shot before the end of October. Dr. Max Gomez, TV 1055.